Good afternoon and welcome to the April 27th Community Update on the COVID-19 response in Buncombe County. My name is Stacy Wood and I serve as a Public Information Officer in the Emergency Operations Center. As a reminder, this Community Update is also available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found at BCHHS. Today's updates include quick presentations from Dr. Jennifer Mullendor, Buncombe County Medical Director and Interim Public Health Director, and Eric Barnes, Buncombe County Public Health Emergency Preparedness Assistant Director. We will get started with an update from Dr. Mullendor.
Good afternoon. As of noon today, there have been 54 lab-confirmed cases of COVID-19 in Buncombe County residents. There remain 3 COVID-19 associated deaths in Buncombe County. At this time, there remain no lab-confirmed cases of COVID-19 in any nursing homes or congregate living facilities in Buncombe County. With regards to testing for COVID-19, over 2,200 tests have been conducted by providers in Buncombe County since the start of the outbreak. Looking back at the data that has been reported to us, the number of tests conducted on county residents last week following the relaxation of restriction on who could be tested has increased and was about 7% higher than the prior week. So we know that we are moving in the right direction, but that we still need much more testing to occur. In Buncombe County, we know that some primary care providers and urgent cares have adapted their processes to enable safe assessment and testing of individuals with symptoms of COVID-19. And I know from conversations that others are working on making those changes. The county has spoken with leadership in our local federally qualified health centers, and they are drafting plans for how they can get testing out into under-resourced areas of our county. We continue to speak with leaders of our local healthcare systems to see how they can support increased testing in our community and in the region as a whole. I am optimistic that we will continue to expand testing opportunities in our county so that anyone with symptoms of COVID-19 who seeks testing can find it. At this point, if you have symptoms of COVID-19, fever, cough, shortness of breath, we encourage you to call your healthcare provider to be assessed and to see if your provider recommends testing. If you don't have a primary care provider, you may call a local urgent care or Buncombe County's hotline at 250-5300. With regards to contact tracing, Buncombe County currently is able to perform this for every case of COVID-19 that is reported to us. We have 7 staff who are currently assigned to conduct case investigations and contact tracing. And we have additional staff that we will be training to assist with these efforts should the need arise. North Carolina's Department of Health and Human Services is also working to increase contact tracing capacity statewide. I encourage everyone to continue following the guidance of staying home, away from others outside your immediate household, of wearing a cloth face covering when you go out into public and you can't maintain your physical distance, of hand washing and cleaning and disinfecting frequently touched surfaces. Know that it is making a difference, and it is helping to protect you, your family, and our community. Thank you.
Good afternoon. I'm Eric Barnes, Public Health Emergency Preparedness Assistant Director. I'd like to take some time this afternoon to answer some of your questions regarding our COVID-19 response. First question, I just wanted to check in about Buncombe County's COVID-19 symptom checker tool. Is that still scheduled to go live today? And if so, do you know about when in the day that will happen? We are still finalizing some details on our self-checker tool. We hope to be able to share the final tool with you in the near future, and we will be sure to push it out to all media once it is live. Next question. If the county is laying out the next steps forward today, could you please explain in which areas it may be more restrictive, if any, from what the governor's and state's orders may be? Buncombe County is still developing and drafting our framework for reopening. Our intent is to align ourselves as closely as possible with the governor's guidance. This may include relaxing some local guidance to fall in line with the governor's planned phases of reopening. Next question. Has the county received any cell phone data that might let them know whether people are social distancing, following guidelines, or not? Buncombe County is not collecting or interpreting any cell phone data. There are some social distancing scoreboards available online, but the methodology of these trackers is questionable, and we are not drawing any conclusions based on their data. In closing, as a reminder, the deadline to fill out the U.S. Census has been extended to October 31st. So no matter where you call home, please take some time to take the census so that our schools and emergency services get the resources that they need. Visit 2020census.gov for more information. Thank you.
In closing, we encourage the community to also use buncombecounty.org as a resource for valuable information specific to Buncombe County. We will provide the next community update on Thursday at 2:30 p.m. Thank you.